with chronic sinus problems have pain every day with little or no relief.
But today, new techniques and technologies can help. In fact, our next guest has even pioneered some of them himself. Dr. Madan Kandula is with the Advanced Ear, Nose, and Throat Specialists, also known as Advent. Thanks for being back on the show.
Thank you.
Hi,
Thank
Doctor.
you.
Nice to have you.
Nice to be here.
So first of all, let's talk about one of the things that I think it would be good is just talking about there's all these different ways to treat sinus infections, I guess, at the source. Because a lot of people's problems start with probably just the average sinus infection, which a lot of people like me have had on a fairly routine basis. So there are 3 different ways to treat it at the source, right?
Yeah, exactly. I mean, what we're trying to do is sort of flip things around. And usually medicines to treat sinus infections are antibiotics and things that way that you have to take by mouth, and they've got to go through your whole body to get to the sinuses.
Right.
You know, it'd be neat, we think, to kind of flip it around and see if we can't get things there directly into the source. So go through the nostrils to get there. So antibiotics and other medicines, steroids, and things that can really help the cause, but we don't have to sort of harm the rest of the body to get them there.
Okay.
Yeah, and you're a real pioneer here in the area of bringing new technologies and new ways to treat your sinuses. In fact, you were the first surgeon in Wisconsin to implant this device called Micraflow Spacer. What is that?
The Micraflow, it's an implantable device that we implant into the sinuses, and what it does, and this shows it here, is it gradually leaks out of medicine. So we put this in typically during a surgery, and what we do is we put the device in, we fill the device with medicine. Currently we're using a steroid medicine, and over time, usually over about 14 days, that gradually leaks out into the sinuses. And so what you have is something, instead of taking an antibiotic for 14 days or 21 days, we put this in, and it's doing it behind the scenes, so you don't have to do anything to it. This is for somebody who's got more serious trouble. This isn't just the run-of-the-mill infection.
And because it's a steroid, is the purpose to kind of shrink that tissue there?
Exactly. So sometimes we'll go in and we'll expand the openings and then put this in to help to kind of booster our cause. Other times we'll just put this in by itself to try to shrink down tissue on its own.
And why is it, or how is it then that it's easier on patients?
Instead of taking a steroid by mouth in this instance, we're going directly to the source. We can get the potency up sky high, so we're able to get a concentration of medicine into the area where we want to get it into without having to blast somebody's body away. It's easy on the patient themselves. They don't have to deal with being on a steroid or antibiotic
and all the side effects that come with steroids.
Exactly.
Okay. And then if the infection still persists, though, what else can they do?
We've got, this is sort of very, very minimally invasive on the procedure front, so we can keep rolling up the ladder. Again, this is not for the run-of-the-mill, one infection a year or anything like that. This is folks who are getting lots of infections or have infections that just aren't going away.
You've also developed a way called a topical antibiotic therapy, because what you just mentioned there with the Micraflow was a steroid. So there's also a way to deliver a topical antibiotic as well, right?
Exactly. Yep. And what we do with this is we're able to leverage folks who may have had previous surgery, or we know that their openings are open, but are just sort of stuck in infection. This shows a picture of this. This is a way we are actually able to spray antibiotics and steroid medicines into the sinuses themselves just through the nose. So it's sort of like a lot of folks have seen just a saline spray or a Flonase sort of medicine. This is like that, but we're able to deliver the type of medicines that aren't available otherwise. So we can get really, really high doses right to the source.
And again, we want to point out you developed this, correct? How did you come up with this idea?
Well, it's something, the concept has been around, or not been around, it's sort of on the forefront. So anybody who really deals with sinus infections, this is the next wave of things that we're trying to deal with. And what we're trying to do is just figure out easy ways to get things there. And so there's a local company who develops the medicines and compounds them for me, and we're able to work together. And really, it's been, for folks that need this sort of thing, it's been a dramatic improvement, far and away, above and beyond things we've been able to do in the past.
And one of the things I noted here, it seems like in the times that we visited with you, it always seems like you're involved in, like we said, pioneering new techniques, sometimes even teaching advanced procedures and techniques to other doctors. And I wonder just why it is that you focus so heavily on all these new technologies.
I think that's the reason I got into what I'm doing, basically, is I want to help, and we've got a core knowledge of the things that I was trained on, but that's not the end of the road, that's the beginning of the road. So what we're trying to do is keep pushing the envelope, keep pushing those techniques. For me, it's great. I mean, like for instance, the spray we were just showing, it's great to see something new that you can employ that makes a big difference for folks. And then it's great to see that being employed, around the state and around the country.
Do you also use nasal rinses too in your
absolutely.
practice?
Yeah, that's one of the cornerstones of what we do, and that's my favorite bottle. Is that most people are used to kind of the genie bottle looking.
You have
guys.
a favorite bottle?
This is my it's the brand of model I really like, but it looks like a little sports water bottle that you spray in your mouth, and instead you're able to squeeze and get a nice pressure, a comfortable amount of pressure. But with this, we're able to do not just saline, but we can put medicines in that as well nowadays. And again, for tough infections or infections that just don't want to go away, we can really use something as simple as that and leverage that to really help folks.
I know what you're talking about with the genie bottle, because I have one of those neti pots, and I know that that's kind of the new thing. It's a more holistic approach with cleansing the sinuses if it works. And people who have sinus problems on a chronic basis, I'm sure that some of the things you're doing are actually changing their lives, because having a sinus infection or chronic problems can really bring someone down. We're going to put up the information for Advent right now. Advanced Ear, Nose, and Throat Specialists. They're located on Mayfair Road. Here's the phone number for more information, 414-771-6780. There's also a web address. It's advent.md. Always a pleasure to see you. Thanks for being here.
Thank you. Thanks for having me.
Nice to have you. And